often say with my students, the hardest thing about Ayurveda is to pronounce it. And I often have students who after 12 weeks are still struggling to pronounce the words. But basically Ayurveda comes from two words in Sanskrit. Ayus means life and Veda means science or knowledge. So I'm often asked, Ayurveda, how would you define it in one sentence? And I'd say, well, it's basically the science of life and longevity, but I think more accurately we could say it's the art of living. So how to live your life well, so that at the end of the day you put your head on the pillow, hopefully you take your last gentle sigh, and you look back on a life that was lived to the full. And that's really what Ayurveda is about. It's not just about the treatment of diseases, it's actually how to live a life well lived. I would say Ayurveda is good for just about anybody. I mean, in my own practice I see people who are basically well, and sometimes they'll come in through the door almost apologetically saying, actually there's nothing wrong with me. And that's a lovely place to come from, because Ayurveda is very strong on well-being, on preventive medicine, and I would say being proactively engaged in having better health. But it also has a lot to offer people with serious illness, and in my practice I certainly see a lot of people with cancer, MS, chronic fatigue, who've really been debilitated by their experience of illness. So what does Ayurveda have to offer? I would say it offers a very holistic approach which embraces the physical, emotional, mental and spiritual levels of our lives, and gives lots of structures and distinctions in how we can work to create healing and the conditions for healing to take place in our lives. The structure of the course is that you get training in the basic principles of Ayurveda, how to accurately diagnose body type, and also how to treat health imbalances using diet. So there's a big section on nutrition, through lifestyle modification, and they also get trained in how to give a very relaxing, warm Ayurvedic massage. So the course culminates in a student clinic, and the students have the opportunity of actually dealing with members of the public, doing an Ayurvedic lifestyle consultation and Ayurvedic massage. And so it's a very practical kind of outcome, and I don't know too many courses that can, in Ayurveda in Australia, that offer that clinic experience, which in my experience is invaluable in order to help the students to really integrate the learning and to be able to take that out into their professional lives. So one of the things that I think is really important in Ayurveda is it's an oral tradition. So, when I was in South India, I'd met Ayurvedic physicians, and their families had been practicing Ayurveda for, 400 or 500 years, father, son, mother, daughter tradition. So the fact that it's oral, I don't think it's something that you can really get to grips with just through doing distance learning. I think that the fact that you're having an ongoing relationship with the teachers week in, week out, and also benefiting from the fact that the campus itself, there's a lovely vegetarian cafe, the library, free counselling services if needed. And I guess what I observe about the students is that they tend to form quite a close kind of bond and connection, and they sort of travel through the course together over those 2 years. And it's really nice to me. I see them transforming, I see them healing in various ways. And that's a really nice thing for them. And I think a lot of them actually, when they finish their course, it's actually quite sad for them because they're not going to have that ongoing regularity and contact and support. So that's a dimension to it all that I think is really quite special. And the thing about Ayurveda, it really understands how the mind and our emotions affect our physical health. And I think that Western medicine and the Western medical paradigm has so much to learn from that. And that's going to be so much better for the people who are coming, for guidance and help with their health. So I think spreading that word through having a college, through having wonderful graduates, that's been a very kind of enriching experience. Whereas if I was just in private practice, I think I would probably feel a bit constrained or a bit limited by that. So for me, I'm pretty much 50-50 teacher-practitioner, but I would say the teaching and the educating, organising courses hopefully that people come out at the end who are well equipped and well able to go into a contemporary setting. One thing about Ayurveda is it's not something we just plonk out of India and drop into 21st century Australia. It needs to be very contemporary. And in fact, you know, I actually have a very strong interest in Indigenous healing and have some friends who are Indigenous healers. And when we talk, we're just on the same wavelength because of the holism of Ayurveda, and it really recognises that all of us are all interconnected, just as they do in that tradition. So that's a really nice thing for me to know that the ancient traditions of this country are very much in sync with Ayurveda. And I guess I'm moving towards creating a kind of Ayurveda that's truly Australian and appropriate for this land.